It's really good to see so many of you here today. Hope that the talk will be enlightening and that we have some questions that I can hopefully share my expertise and my ideas at the end of this session. Just a bit about myself. As the introduction had mentioned, I'm actually a consultant psychogeriatrician at Tan Tock Seng Hospital, and that's actually my day job. Part of the job requires me to actually work closely with the geriatricians to help patients with both physical as well as psychological problems. Okay, sorry. I'll put the mic closer. Sorry about that. So I have seen firsthand the challenges of the elderly that the elderly face when I actually engage them at work. And therefore, this topic is actually very close to my heart. I see that it is actually a challenge that they face not only amongst the family members, but also of the patients themselves. And I fear that this is actually a tip of the iceberg because the patients that come to see me obviously are getting help, but a lot of them, because of stigma, because of the problems that they face, they don't come forward to have help. And that's why I think this topic is very important. Also from a personal point of view, when I was a young kid, O-level student, on hindsight, on thinking back, my grandfather most probably suffered from dementia. And we didn't know why he was behaving this way. On hindsight, if we had known, we may have been more sympathetic, the care may have been better, and we may have done things differently. And so that's why this is such an important thing. And sharing some of these ideas and how tech can actually help would be, I guess, in a sense, my hopeful contribution to prevent problems from happening. Having said that, today I'm speaking as a co-founder of Ninka Tech. Having worked in the healthcare industry for a very long time, we see a lot of problems that keep coming back again and again. And so a group of friends, an oncologist, a family care physician, and myself came together to decide to say how we can actually leverage on tech to actually help our patients better. So combined, we've been friends for a long time, and therefore combined experience, we are talking about 60 years in practicing psychiatry together, medicine together. So Ninka Tech actually is a patient monitoring solution provider. The platform integrates monitoring, but also that of clinical expertise. And this is actually hoping to actually help frail elderly patients actually have the wish in terms of having a fruitful lifestyle as well as staying at home. We are actually at a very unique point in time. If you look at this, we are actually here, 2019, when the number of people that are above 65 are actually the same as the number of people that are less than 5 years old. Clearly, the population dynamics is changing such that past this point, there will be more old people than young people. So that is what we refer to as the Silver Tsunami. The concern is the Silver Tsunami is actually a metaphor used to describe the aging population. This phenomenon is actually going on throughout the world. Actually, people like me don't really like to use the word Silver Tsunami because it's quite frightening. And at the same time, it actually stigmatizes, inverted commas, the elderly, like as if it's a problem that we need to do. But having said that, I think it's still important because the alarm bells that ring as a warning sign is actually important for the call to action. As you age, the chance of dementia actually gets higher, and that's my expertise. By the time you're 85 or more, 1 out of 2 persons may start to have memory problems. So imagine if you are the lucky one, even without the memory problems, most probably the people around you and you'll be helping to look after people with memory problems. The other thing, of course, is to a certain extent, the young people will have to then help look after the old as well as their children. And therefore, this is, I think, a very important call to action to prepare for these changes. I listened to the thing that was going on before, and I think it's very, very pertinent that you keep engaged, you prepare for the future, and this information will give you some idea on how to do that. Just a bit more to examine this. If you look at the world, which is here, round about here, The people that actually have the aging population are Japan, parts of Europe, and that's about it. Very much of Central America, Africa, and this part of the world is actually spared. They're a very young population. But if you move to 2050, by then I will also be 80 years old. Right? So that's why there's a bit of a hidden agenda to get this done, and so that my care, as well as the care of my generation, will be looked after. If you look at it, Europe will be old. Japan will be old, and most of the world would have really been 20 to 27%, except sparing part of Africa. So that's the concern there. And if you look, then examine Singapore per se, what I guess is giving us a bit of concern, at least from my daily practice in medical care, is that past 2010, 2020, 2030, Singapore's aging population will escalate. And this is actually from Straits Times. Right? And so we actually will be the fastest aging population compared to China, Germany, United States, or the world by the time it comes to 2030, 2040. And that's why this is an important thing to look at. As with a lot of my teaching, I like to start with a story. So this is a problem of aging that has been seen for eternity, ancient times. The story tells about Eos and Titanus. Eos is actually the goddess of the dawn. So she's one of the Greek goddesses that lived long, long ago. So every morning she would come refreshed and new. As with a lot of this Greek mythology, they like to eye humans and then have relationships with them. So in this particular case, she saw a handsome young man called Titanus, who she actually said who want to have a relationship with. And so she went to Zeus, which is her father, which is the god, to ask, can you make him immortal so that he can continue on this with me? And so Zeus actually granted him that wish. But as the days went by, they noticed that actually Titanus was growing older. His hair was growing gray, his strength wasn't so good, his eyesight wasn't so good, and he was actually aging. And Eos wondered what was going on and went back to Zeus. She realized that she made a mistake. She should have asked for eternal youth as well as longevity or eternal life. But by then it was a bit too late. As he deteriorated and grew older and older, 100 years old, 200 years old, he eventually lost his senses. And in mercy, she actually converted him to a cicada or a cricket. And therefore, there's a story that the crickets remind you of this tale. Now, why do we bring this back? I guess to a certain... Yes? Yeah, go ahead. You are free to have the slides or take the slides, no problem. This is all free information. Why do I bring this up? It's because longevity needs to come with good health. And Singaporeans are like to be number one, but we are going to be the country with the longest lifespan. And therefore, health ends up being very important. Let's go through some of this. This is the common thing that we see when we grow older. So we go bit by bit. You know, this may have been seen in Titanus as well. His skin becomes a bit more wrinkled. There may be a bit sunspots. The immune system may be not as good as before. The heart may have slowed down. The structure's a bit thicker. The ejection fractions or how the heart function slows down. The endocrine system, things like thyroid, things like diabetes, cortisol may also change and be less compared to before. The composition of the body changes. Clearly, the muscle mass is less, but the fat content is more. The bones may be a bit more weak, and of course, the joints will be wear and tear. The urinary system may be a bit slower than before. The digestive tract may not digest food as quickly, and therefore medicines may work a bit more slowly. The muscles may be less weak. And as mentioned, the eyesight, the hearing, and the senses may actually not be so great. But these are normal changes. Things may be slowed down, but still within a normal range. The challenge and the problem is that as you grow older, the risk of it going beyond the normal change is higher. So if you look at this data, by the time we are moved since 2010 to 2030, the numbers of diabetes will go up, the heart will go up, heart attacks will go up, cancer may go up, and stroke disease may go up. And this is partly due to the aging process that has gone beyond that normal position. This is my specialty in looking at the brain. So Alzheimer's disease, or the dementia in Alzheimer's disease, has actually been described more than 120 years ago. The first time someone described the condition of Alzheimer's disease and did an autopsy of the brain, the information was already known. So this is actually normal aging. There may be reduced in the ventricular size, in this part of the brain may be reduced. There may be some loss of the gray matter, and therefore the spaces may be more. But these are actually quite normal. Clearly, this other side shows more dramatic changes in the brain, especially in the areas of the cortex, the spaces here, as well as the hippocampal area. And this is an area that is very important for memory, right? So these are the changes in a person with Alzheimer's disease. Now, dementia per se is a condition where you talk about overall deterioration of memory. And there are many causes of it, but we focus very much on Alzheimer's disease because it is the highest proportion. 60 to 70%, if your memory gets worse, will be Alzheimer's disease. 10 to 20% will be that of a vascular dementia, which we are referring to stroke-related disease. So if you watch these two closely and you manage that better, you would have helped almost 90% of the condition. And that's why it's very important to focus on this, the majority of the problems. This is what I would share. It's a bit complicated, and I can try my best to simplify it, or if later you have questions, you can bring up. So as I mentioned, Alzheimer's, Alonso Alzheimer's already knew that the brain had shrunk, and it's caused by these things called the amyloid plaques and the tangles, tau tangles, neurofibrillary tangles. But at that point in time, nobody knew how it came about. So they could actually autopsy the brain, see that it's there, tell you that it's dementia, Alzheimer's, but they don't know how it came about. And that's why for the longest time, Alzheimer's treatment was very much care, and we couldn't change the trajectory, right? So if this starts accumulating in the brain, it causes the problems that we talked about earlier, and therefore, but because we didn't know how it came about, there was nothing we could do about it. But in the past 20 to 30 years, with advancing medical research, we can tell how these plaques and these tangles actually form. And once we are able to tell how they are formed, we are able to bend the curve, change the direction in which things actually can happen. Having said that, we are actually still in the beginning, and present treatment for memory problems are like this. I tell my students that the condition is like this. Imagine you're a factory. The brain is a factory. And because of the disease, the dementia process, you are slowly retrenching workers in the factory. And so because you are retrenching workers in the factory, the output gets less. The present treatment for the Alzheimer's disease is to make the workers work harder, right? So I give you bonus, I make you work harder, which is the medicines that we give. So with the remaining cells, the cells work harder, and therefore you try to maintain the function. And that's why with present treatment of Alzheimer's disease, the deterioration actually gets less. It still goes down, but it's less than if you don't give the medicine. But if you think about it, if I keep retrenching workers, there will be a day when how much efficiency that I make will not be able to keep up with what needs to be done. So that's the present treatment. So if you come to see one of us for a doctor, the explanation is that we can help mitigate, reduce, slow down the illness, but at this point in time, although there is a bright future, we are not there yet. Having said that, technology and research are based on two things, and we will be getting there. I anticipate in the next 20, 30 years, 40 years, we will be getting there. And the strategy is actually twofold. The first fold is to actually stop the disease and possibly reverse the illness. Now, how do we do that? If I know how the amyloid plaques are formed or how the tangles are formed, when I give the medicine that stops it from being produced, the disease doesn't progress anymore. So that's the idea. And so research has gone to see how do I arrest the production of either these harmful proteins. So that is the first step of how we actually help. But that is actually not good enough, because if you think about it, all these damage, inverted commas, that happens before, all the damage because, for example, amyloid, tau protein, these actually are produced, the red line and the green line are produced even before the symptoms come on. And so the second arm of research would be to be able to predict who will get dementia or who will get these problems, so that I give you treatment here, it doesn't even progress there. So the future of the research is there. And as I said, in next 10, 20, 30 years, we are most probably going to get to that direction, to arrest or to slow down this condition. So as I said, we know very much more than when we knew 100 years ago. In the past 20, 30 years, based on research, technology, we really know much, much more. But to then translate it to the point that we can now say this drug is safe, this drug can be used to stop and we can then predict accurately who will get or who will not, that is akan datang lah, right? In about 20, 30 years' time. Hopefully faster, because as I said, if we have the rallying call, right, to say this is a big problem, more resource will go into this and more can come out of it. So that is the background story behind that of how we can actually avert or reduce or slow down some of these problems. I will be able, if it's not clear, can take some questions later to clarify the information. Now, let's move on to what we can do today. As I said, I see the patients, I see patients every day and they go through very similar problems. We can start them on the medication to reduce the problems, but at the same time, there are some things that keep recurring. So this is where tech may come in. We'll go forward with 3 case examples that may sound familiar. It is not a single patient that I am putting up, but clearly it is a composite of patients that I see in the hospital. Okay? So the first case, someone with very mild memory problems. So Mr. Goh, a 79-year-old retired executive who is living with his wife, very common. Son working, living apart. Son at 78 years old, the son is most probably 30, 40 years old. Now he's fairly active, goes around the neighborhood, he does his daily exercises, has some mild medical problems which is seen by the general practitioner. Some hypercholesterol and is followed up regularly. So he's actually very, very active. Doesn't seem to have much of a problem. Unfortunately, as we had mentioned before, as the person ages, the memory may start to deteriorate. Whether it breaches the threshold of it being so serious, time will tell. But certainly, there was this gradual forgetfulness. So he did miss appointments. In his estate, no problem. But when he goes to somewhere familiar, unfamiliar, it's a bit of a problem. Even my parents would say, at night, I dare not go out already. So it's too bright, I won't. So you won't actually know. And so there was some alarm bells raised. He saw the geriatrician, the tests that are done. Invariably, actually, in such a case, it's actually a very good outcome because early picked up, right? And the geriatrician says, not a big problem, let's just watch. I give you a 1-year appointment. I give you a 6-month appointment. That's actually what happens. But certainly, there is a concern by the family's point of view, right? Who's going to monitor? What's going to happen? And so the son, although wanting to respect Mr. Goh's independence, is worried that he will be safe and allowed to go out alone. So these are the constant worries as a psychiatrist I see. And it's actually very challenging because it's a new negotiation, a new identity, a new change, and therefore how do we negotiate that? This is traditionally what happens in the hospital. They hire a domestic helper, right? So say, sorry lah, you are 78, one person more to watch. I think valid, right? As a child or I would be concerned, and I think it's fair to see that this is a solution. But you realize that there are other challenges, right? So there's a resistance of having someone in the house. Apart from the fact that you have to house someone, you have to feed someone, you have to pay, the challenge is that this sense of loss of dignity, loss of independence. Then, of course, there's genuine concerns of the patient safety, and that's why it's asking. There's actually increased costs and all the concomitant challenges that comes with a helper in the house. So these are but unfortunately or fortunately, this is the traditional way in which we would say, this is how we help. Now, but what say if we have the ability to use technology to give someone assurance? There is technology like geo-tracking, geo-fencing. If the person actually goes beyond a certain neighborhood, you'll be alerted. You can tell where the person goes. Would that give you reassurance? Of course, the monitoring of the activity, the sleep, the heart rate, so on and so forth, may give the geriatrician or his family doctor more accurate data on how to manage this patient. The biggest challenge I have a lot of time in clinic is that I don't have enough information. I ask the helper what happens at night, how much he eats, and I'm not sure it's accurate. And to be fair, when the family members are distressed, are upset, they may either play up some things, and unfortunately, this is anecdotal. Daughters-in-laws are much better at giving information than the sons. The sons will say, everything is okay, no problem, right? Independent. And so the big problem or the big challenge I always have is how accurate is this information, because I will make decisions based on that. But in this new day and age, if I can have objective data, it will strengthen the way in which I would say conviction to say, you're well, carry on, or no, I think we should watch more closely. So tech allows us to respect the patient's wishes to a large extent until the point where you can't anymore, and you have objective evidence to show yes or no. At the same time, there's assurance that potentially cost savings, you may not need a helper, so on and so forth. And as mentioned, accurate information is the key to the doctors. Second example, again, very common. Madam Tang, 72-year-old housewife who is living with her husband and domestic helper. Her 2 children are married and living apart. Madam Tang has diabetes and high blood pressure, as well as osteoarthritis of the knee. As mentioned, it can be normal changes as the knee gets older, but if it's getting very painful, swelling, and it's affecting the function, then it becomes a bit of a problem. She's regularly followed up by a family doctor and is fairly healthy. So she goes for a total knee replacement. She goes and has an operation for the knee, and is then due for discharge. The procedure is actually successful. A lot of patients don't want to stay in hospital. The food, as much as we say, has improved and changed. The food is, don't let it leave this room, isn't all that good. That's why family members go downstairs, buy them food, and so on and so forth. And sometimes it's very noisy, and so on and so forth. So they want to go home. But understandably, again, there is a worry. What about the chronic conditions? Who's going to monitor? So on and so forth. Yeah, and in this particular case, there is a domestic help. There is a elderly husband at home, and very worried whether they can cope with this such situation. Now, what is traditionally done? Usually, it is an extended stay in hospital, right? Make sure that you're well. Make sure that you have achieved certain things. Then we will let you go home, which may extend to a week, 2 weeks, right? We know that if you don't sleep too well in 1 week, 2 weeks, you don't eat so well, it also impacts on how fast and how well you recover. And the concomitant challenges is increased cost, increased risk against the patient's wishes. But as a doctor, my biggest concern is this inadvertent increase of risk of infections. As mentioned before, already in the elderly, there's a decreased immune system. And if you keep in hospital for a long period of time, there is an increased risk of possible catching an infection. So these are the challenges. Again, with technology, what can be done? If you have a continuous monitoring of the patients for 1-2 weeks before of the operation, know their activity level, temperature measuring, blood pressure measuring, how well they are sleeping, also linked up with online type of medical assistance, and even, say, actively have a home visit by the doctors to actually monitor. It may give the family assurance, help in terms of cost, but again, talk about increased ability to say that this is actually very, very useful. So, as mentioned, if you ride the wave, the tech wave, we are talking about observing or trying your best to respect what the patient wants. There may be some level of cost savings, especially given that hospitalizations is increasingly more expensive. And of course, to a certain extent, as mentioned before, the data can be accurate. And if it's accurate, you can actually then say when to come back to hospital if necessary, when it's okay to stay, and give the family that level of reassurance. The final example which is also very common, and it does contribute a lot to why the hospitals in Singapore are so full. It's because patients do recurrently get into hospital. And it's not that they want to go in, it's because they genuinely do have medical problems. So an 82-year-old trader who's living with his wife and a young family, high blood pressure, chronic heart failure, and the heart failure is the thing that makes him breathless. He's followed up regularly by his heart specialist. But as expected, at 82 years old, the heart failure will get slowly worse with time, and therefore leads to recurrent admissions. I've seen this downward spiral. The breathlessness gets more, the patient gets more anxious. Unfortunately, the breathlessness gets more, and after a period of time, you don't know whether it's really the breathlessness, or is it anxiety, or is it both contributing to the problem? So that is a very difficult thing to tease out. So he's increasingly anxious, he's increasingly breathless, and this has resulted in a few admissions that were triggered by worries. So they'll come in, minimum amount of treatment, the breathlessness gets better. There is a big challenge in that case. So the traditional treatment is they continue to come to hospital, right? There may be more frequent visits to the specialist, but the specialist will not know when the issue happens. So even if I make regular visits to the specialist, I may not catch it when the breathlessness happens. Unfortunately, eventually, a lot of this, if it cannot be coped, it ends up being institutional care, which is what we are trying our best to avoid. So this is the challenges. Of course, if you go to hospital, as mentioned before, there's a increased risk of infection. And to be fair, if this happens and it is at home without any monitoring, as a doctor, it becomes very difficult to give you anti-anxiety medicine, because that medicine may make you drowsy, may make you sleepy, and then you will not know whether how much of it is contributed by the anxiety, and breathlessness will get better. So it gives us a lot of worry and become very careful in prescribing such medicines. At the end of the day, the patients may not do that well in such a situation, this type of traditional type of treatment. Now, continuous heart rate monitoring, activity monitoring, sleep, heart rate, activity, so on and so forth, linked to online, as well as complemented by doctors and nurses actually giving both online as visits, may actually help reduce these problems. So if you think about it, until the holy grail is actually reached where we actually can arrest and stop and adjust the memory problems and the physical deterioration, we still need to make do till that 10, 20 years comes down. And this is where I think, based on today's topic, how tech can actually help. Tech can help the people caring for the patients to be more confident. It also gives assurance that you're being monitored and you're watched appropriately, and in the future even be able to predict when you need more help and come in beforehand. So these are the possibilities. So we are talking about the structure. And from some of our patients that have managed to do some of this tech, some of our beliefs has actually been borne out. So from patients' voices and family voices, there's a patient that was so worried that kept going to hospital again and again. It says, with this monitoring, it allows us to have some assurance, and so and so. So there shows to be there will be some benefit in using this. And the ability to then monitor in the various situations, minimal needs, acute needs, or even chronic, unfortunate, long-term, end-stage type of heart problems or liver problems or kidney problems. So with that, I sort of went to an overview in terms of what dementia is like, what future holds in terms of research, technology, and what we can do. But until then, there are some technological advances that we can actually tag on to try to make it easier for people who are growing older. Thank you again for all your attention, and it's very good to see all of you here today. Thank you.